Welcome to 2-minute anaesthesia in critical care. Let's discuss intravenous cannulas. The first cannula designed for intravenous use was the Strauss cannula, created by Hermann Strauss in 1907. A cannula or catheter both mean exactly the same thing, which is a flexible tube inserted into the body to give or remove fluid. The basic structure of a cannula is shown. It's composed of a luer lock plug, a flashback chamber, a luer connector, a needle with catheter and wings. Different manufacturers use different colour schemes, so it's important to know the different size gauges and their corresponding flow rates. The calibre size of the cannula is expressed as gauge. As shown in the table, there's 14 to 24 gauge and the most commonly used cannulas. The gauge, or the Birmingham gauge or stub iron wire gauge, was developed in the early 19th century for the use in wires. The lower the number corresponds to the greater the thickness of the wire. As the wire is stretched, it becomes thinner and the gauge increases. It has subsequently been applied to medical devices including needles, catheters and cannula. This device allows detection of the size of the gauge of the wire and therefore the cannula size, for example. Now we can further discuss this table. The maximum flow rates do vary based on the book you to read. However, as the gauge increases, the diameter reduces and the length also reduces. The length between 14 and 18 is approximately 45 millimeters. However, this does reduce for cannulas with a gauge of 20. The maximum flow rate for 14 gauge cannula is 240 mils per minute. However, this does strikingly reduce to 10 mils per minute for 24 gauge cannula. This just simply reflects the calibre size. So the large calibre, the length is also larger, whilst the smaller calibre, the length is smaller. Fluid within a cannula is described as laminar flow. Molecules within that fluid move in parallel in a particular movement, with a central higher flow rate. Laminar flow is described via the Hagen-Purcell equation, whereby on the top line, pi is multiplied by the pressure difference across the tube by the radius to the power of 4 divided by 8 multiplied by the viscosity and the length. And therefore, if you have a cannula and you would wish to deliver a large volume of fluid, the best way would be to have a significant pressure difference, a large radius and a short length. The complications patients can experience during cannulation are broad. These can be acute or chronic. Acute will be pain, bleeding or accidental arterial cannulation. Chronic complications will include infection, extravasation and failure due to blockage or displacement. Once again, thank you for listening. Please like and subscribe if our content is useful.